I did my senior lecture on pre-travel medicine. It is not going to be medicine in austere environments. This is going to be how to go on vacation and not embarrass yourself in front of your friends and in-laws. So the world's opening back up. Some of us have managed to get some trips in, but not nearly in the way that we used to. I don't know about you guys, but I don't even know if I remember how to travel. When we get the green light for extensive and international travel, I'm buying my ticket ASAP. So in preparation for that today, we're going to talk about travel from the perspective of the physician. The goal is to think about travel the same way you think about medical care. How can I be best prepared? How can I get the best bang for my buck? Make sure that I have all I need without overburdening myself. And how do I have appropriate contingency plans? You don't want to be on vacation with your friends or family and get caught unprepared. You might try to take your doctor hat off, but it's still going to follow you. So recently, I went on a weekend hiking trip with 6 local other ER, medicine, and gen surg residents. Everybody bought alcohol. 3 people bought Nintendo Switches. 1 person bought 160 pizza rolls. Worst of all, nobody bought essentials and nobody planned for coffee. So that kind of inspired me to say, like, hey, how should I have done this properly? How can like 6 physicians maybe have been better prepared? So these are some of the items we want to cover to make sure that doesn't happen to you. Some things are going to be a little more medically relevant than others. What we're not going to do is discuss, this is not a lecture on bug out bag, okay? These are different than what we're going to be talking about. These are incredibly important depending on where you live and the potential for man-made or environmental disasters. This is the peak of preparation, but nobody travels this way. If you're interested in this, you can buy one online, or yeah, there's lists online where you can make your own. So first, the essentials, right? Phone, wallet, keys, ID. The mask is now on the list of essentials for me. I know the CDC said masks should still be on your list. When I travel, I link in my head my passport to my ID. Those 2 things are one in my head. Don't forget your chargers. I think a lot of us have external battery packs now. I'm a big fan of them. Went to Tanzania and it lasted my battery pack. I only had to charge it once and I got like 6 to 8 charges out of it. You should have all the apps that you need to get by. Those are different for everybody. I'm just going to push for having a Maps app that works when you're offline, a Messenger app that works through Wi-Fi, and access to your finances. I put Venmo up there, but you should also have your banking app. I personally need my Kindle. I will drive everybody crazy if I go on vacation and don't have my Kindle. Get an international roaming plan for your phone. NerdWallet has a great list every year of the best plans with like the most coverage versus like the most economic plan. Just be careful when you're on NerdWallet. I don't know if you guys know this, but some of their articles are ads and it's like really fine print. So just be careful about that. This is the map for AT&T. It was upsetting when I saw like T-Mobile's and everybody else's, and this is mine, and the coverage is shit. Pardon the language, but it doesn't even get you like all of Canada or Alaska. I'm gonna hope that this keeps getting pushed back. I don't know how many of you guys are familiar with this, but New York State ID will no longer be good even for domestic air travel. Okay, so if you would like to fly to like even California, starting now May 3rd, 2023, you're going to need either your passport or to get the enhanced ID. The politics around this are a little not great. Without getting into that, I just hope that it keeps getting pushed back and never happens because I'm putting off that trip to the DMV. My wife did it on a Tuesday morning. They did take a new picture, so be prepared. She was not. This is not a COVID lecture, but we have to at least make sure that for travel, you are being responsible. Remember that you're also representative of not just yourself, but Kings County, downstate, and our residency. So if you're out there being unwise, mask-wise, you represent all of us. So first, get your shot. Hopefully we're all vaccinated by now. Carry your vaccination card or a copy of it with you. Bring an N95, cloth masks for indoors. You're not obligated to wear an N95 on the plane, but we've all worn them now for hours and hours on end without issue. I recommend it for air travel. Make sure you look up the travel and testing rules for where you're going, okay? Just because you got a COVID test 72 hours before your flight doesn't mean you're good. Hawaii has their own testing partner that wants you to get tested with, right? So make sure that you look up your destination's COVID restrictions and you are knowledgeable before you get on the plane. This is a case report from March 2nd. It was a flight from London to Hanoi. It was March 2nd, 2020. It was right before we all started masking and went into lockdown. This circle identifies patient 0. The seats that are in light orange are all people believed to have contracted COVID during the flight. So we know the CDC has changed the recs on masking. This is indoors, so I don't know exactly what they said. My rec is that you still wear the mask indoors. Some of these people are more than 6 feet away. So 6 feet in a confined space where air is recirculating doesn't save you. Don't end up like the Yankees, right? Again, just because you are vaccinated and not going to develop COVID as an illness doesn't mean that you will not test positive. Don't ruin your vacation by testing positive, even if you're asymptomatic. Again, the CDC says what the CDC says. I'm not going to get into the politics of the CDC and why I think they did this. You don't have to wear it if you're going to be outdoors, but again, if you're in a large crowd, be responsible. Remember, you're representing us as well. Finances. All right, I'm terrible at budgeting for trips. When I sent out the questionnaire asking you guys about everything, this is one of the things that Dr. Sinner had mentioned that he does because he can do some shopping wherever he's going, Venice, Florida, London. There's nothing worse than getting to your destination and not being able to spend money because you didn't budget. I'm not good at budgeting, but if you overestimate the costs of food, travel, ground transportation, and lodging, you should pan out okay. There are lots of pre-made budgets online that will help you make sure you don't miss things. Make sure you exchange money at your local bank before you go if you're going to be dealing with international currency. It's the best way to avoid transaction and convenience fees. It's getting more and more important to think about because a lot of us are only using Apple Pay while we're here on credit card, and depending on where you go, you might not have the ability to do that. Having your local currency is important. Have a credit card without foreign transaction fees. I always have two. I have an Amex without transaction fees and a Visa, just in case they don't take one or the other. And I try to get my points or cash back. Something you don't consider currency, but I want you guys to think about is if you're going to be going to someplace, again, that is maybe more rural, some checkpoints in Eastern Europe, parts of Africa, Southeast Asia are run by local paramilitary organizations, for lack of a better term. They're usually non-threatening, but you will have to pay with either cigarettes or alcohol or local currency. So that's part of the things that we're going to talk about when we do some research. Also, if you're backpacking and somebody's unprepared, toilet paper will quickly turn into currency. You don't want to be the person running around bartering with toilet paper or for toilet paper. Quickly, transportation, don't rely on Uber and Lyft. You can see it's not even available everywhere in the continental US. Look up your local transportation options, consider renting a car. When it comes to rental internationally, I would say before you go anywhere, go to AAA, get the international driving permit. It's $20 and a quick form that you have to fill out. You don't want to get somewhere, realize you need a car, and then even if you have the money for it, not be able to get one. So this is quick, it's easy, I would do it ahead of time. If you're going to be irresponsible, be responsible about it. So I don't know if anybody, the wilderness medicine people may be a little more knowledgeable. I don't know if Laney's ever used it, but I know Versinti has, and Brian Jarrett has. There's travel insurances that have emergency evac. I've purchased Tripcord and never had to use it, thankfully. A lot of other people like Global Rescue. This at the bottom, all that information is from Global Rescue. They have destination reports and real-time event alerts. So the research that you have to do before you go, there's two websites everybody has to visit. The first one's the State Department. You search your location. Okay, I put in Peru here because it was one of my last international trips. And they'll give you any alerts regarding travel and areas not to go. That being said, here they said there's obviously, they put the COVID restrictions and issues in there. Then they put in one for Laredo, which is where the Amazon river basin is in Peru. And it's actually incredibly beautiful and a place I want to travel. I don't take that alert as an absolutely do not go. It means I have to be smart about when I do go. Either use a professional travel agency or get a fixer, or don't go in there with it being like, oh, I'm just going to go fly in and figure it out. That's just another, I need to be more prepared than I maybe would have been with international travel to a city. They also give you quick facts about your passport, any vaccinations you might need, currency restrictions. Here will also be if you need if you need to go to the consulate, and if you need to get a, what's the word? Visa, thank you. The other website that you have to check out is the CDC. It's going to be more of your in-depth medical information. Again, this is for Peru. You don't need yellow fever vaccination everywhere you go. It's only, again, if you're going to be in the area of the Amazon River. They also give you a synopsis of the communicable diseases, insect-borne, waterborne illnesses. So again, I check this out online and I see like you can get lepto from contaminated water and several insect-borne illnesses. I am now going to pack water purification tablets and bug spray. I did find this great systematic review on vaccinations. It's mostly tells you what vaccines you need for what area, but they also include whether or not it's a live vaccine or not, which I thought was great. And they also included whether or not you can get an accelerated schedule if you need it. So switching a little bit, there are two kinds of people in this world: those that pack 6 days before a trip, and those that wake up day of and realize they need to do a load of laundry. I'm the latter. Hopefully you guys are a little better prepared than that. So now that we've done some of our research, let's start thinking about the physical space we need to actually pack and get everything done. I reached out to you guys to see what you guys like to travel with, and I got some great responses. Duffel bag. I like duffel bags. They're a little less rigid. They have some give. Most of them are carry-on, and you have room for additional garments, suits, shoes, anything else you might need. This is more of my go-to, the backpack with the biggest small rolling bag you can get into your overhead bin. I think that gets you the most space to be able to pack, but also prevents you from having to check a bag, which everyone seems to be on board with. Everyone hates checking a bag. That being said, there are some things that you must check, like sunscreen and fluids over 3 ounces. So if you are unable to pack those things and you don't want to check a bag, think about, am I going to be able to purchase it when I land? Right now, if you wanted to travel, so say it was winter and you wanted to travel to Puerto Rico, right? Sunscreen appears to be really cheap, but when you land, they're going to hit you, and it's going to be like triple the price because they know you need it. If you do check a bag, keep it under 50 pounds. Check your airlines, but most of them are about 50 pounds. Hygiene, some things I shouldn't have to tell you to bring, but again, I just went on vacation with a bunch of physicians and one person bought toothpaste. Toothbrush, toothpaste, deodorant, soap. You can get away without mouthwash, but why would you want to? Contacts, extra solution. If you do menstruate, make sure you have whatever products you need for that. Some things you didn't consider maybe hygiene-wise. How does the infrastructure of where you're going affect your ability to stay clean? Camping in the Adirondacks with running water is different than going to a backpacking trek in the Tetons. Backpacking industrial Europe is different than backpacking Southeast Asia. So is there running water? Will I be able to wash my hands? Post-COVID, I think all of us should really be carrying alcohol or hand sanitizer. Make sure you're able to wash yourself. And again, is there going to be toilet paper? Don't be the person that goes on a trip into an austere environment and not have toilet paper. Please pack enough underwear. I'm not going into this. If you don't know how much underwear to pack, know that this is Googleable. Pack enough underwear. Same goes for socks. Check your freaking phone before you go. Know the highs, know the lows, know the climate. Don't create a medical emergency because you avoided packing appropriately. So talking about what clothes to actually bring. So say you were looking about where you're going to go and you're going to go to Ushuaia, which is one of the last major cities in South America before you start digging into like the Antarctic, sorry. So most cold injuries are exacerbated by how cold it is, the duration of the exposure, the amount of moisture, your age, alcohol use, and medical comorbidities. First up, this one's chilblains. This is small vessel injury from repeated exposure to non-freezing cold or prolonged exposure to non-freezing cold. Trench foot, which is prolonged exposure to cold and wet. When it worsens, you do develop tissue sloughing. Anybody know this one? I didn't really know this one just based off the look. No, right? This is called chilblain. This is paniculitis, sorry. And this is popsicle paniculitis. It is mild subcutaneous fat necrosis due to the cold. You can also develop cold urticaria, treated the same as regular urticaria, histamine, antihistamines. If it's allowed to progress, even non-freezing cold can result in hypothermia. Core body temp drops below 35, you get altered mental status, and eventually death, right? Freezing cold exposure, frostbite, endothelial damage from an arachidonic acid cascade, you get vasoconstriction, platelet aggregation, leukocyte sludging, erythrocyte sludging, results in thrombosis and ischemia. The treatment for both is rapid rewarming, but you also need pain control, all right? And you're not going to be able to rapidly rewarm again if you're in an austere environment. So you have to be prepared. You have to make sure that we're not going to develop any of these problems. So layers, right? Know what it's like before you go. Just because you're going to be semi-local, like anybody, even in the Northeast, we get extreme cold. Anybody that's been to Killington at the top of the lift without the sun can tell you that. You need really three things: base layer, that's your wicking layer, it's your synthetics or wool. It's supposed to keep you dry. Your middle layer, that's the one that's really going to keep you warm. It's your fleece, it's your down. They are graded for different degrees of cold. Check the grading, make sure that's appropriate for where you're going. The outer layer is your shell, it should be waterproof. You can get these as like 3-in-1 jackets, but they're expensive, and that's hard to then doff one layer if you need to remove one. This layering, same goes for underwear, and then make sure hats, gloves, extra socks. REI has great resources on making sure that you are weather appropriate clothing wise. I don't purchase from REI. I look at their website and then I run over to Target unless I need something specialized. On the flip side, traveling to warm weather has a different set of requirements. If you're following baseball right now, this is the Mets level of preparation. They went down to Florida. They were ill prepared, and them getting swept should be a surprise to nobody. Just because you're going out in the sun does not mean that you need to be less prepared. You need more than just sandals and a bag of booze and a pool blow-up toy. Okay. Other team members a little better. Got to be mindful. Make sure that you have light, breathable clothing, eye protection, glasses, and a hat. Make sure you have access to clean water, not just alcohol. We don't want you to develop heat stroke, dehydration, sunburn. Okay. And it happens to the best of us. I'm sorry, T. Could have been prevented if bought your sunscreen. Okay. This was a RCT that was mostly expert consensus, but they did find a few helpful things. Higher SPFs are more effective. SPF 30 is essential for adequate UVA filtration, and you should frequently reapply. Small caveat, there's one small RCT that showed that the chemical sunscreens are absorbed systematically. They don't know the sequela of that, but if it is a concern, use a barrier sunscreen like zinc. They all decrease the incidence of melanoma and non-melanoma skin cancer. Again, the price is marked up at the airport, so this is one of those things. Consider checking a bag if you've got to bring a lot of sunscreen. I have a personal request: if you're going someplace with a reef, please bring reef-safe sunscreen. Proper way to apply. I was taught a tablespoon for each area of your skin. If you break up the torso into chest and abdomen and your legs into thigh and lower leg, then this kind of checks out. Coming back to water, even if you are caught ill prepared and without clean water, there's the SODIS method for decontamination. This one's great for austere environments. Clear containers are filled 3/4 of the way. They're shaken and aerated, then filled the rest of the way up. You put them on a tarp and expose them to the sunlight for 6 hours. It needs to get to about 40 degrees Celsius. And they found that at 6 hours, there were practically no colony forming units of E. coli, which is great. From the SODIS website, though, this technique inactivates bacteria and Giardia at 6 hours. Cryptosporidium takes about 10 hours, but it does not work against amoeba species. So again, if you are ill prepared, this will work, but it would not be my go-to. I love that you love your Nalgene, Dr. Sim, but you cannot use the SODIS method if you have all of these stickers on your Nalgene. So keeping amoebas in mind is probably safe to use halogens. They do kill 99% of all waterborne pathogens. I like chlorine because it's a taste that I'm familiar with and I associate with cleanliness. Iodine tastes a bit off to me. That being said, iodine does have flavor neutralizing tablets because I think a lot of us feel that it tastes off. You should wait 30 minutes after treatment to drink. You could use filtration method or the UV lights. The filters take up space, and the UV light, you're dependent on the battery of the UV. So if I'm traveling in the US, do I really need to worry about my water supply? The answer is yes. Okay. I always just keep the chlorine tabs in my bag. They're so small and they're just so easy to have, and you don't want to be called out. So now, some maybe being a little more medically relevant, we started to touch on medication with the halogen tabs. Before I go into more medications, I wanted to see what you guys travel with. So I polled everybody, and I was actually fairly pleased with a lot of the responses. Your daily meds obviously need to come with you. This person had a good mix of medications for pain, nausea, an antibiotic, Benadryl, which is going to get you sleep and allergic reactions. Again, focusing on daily meds, pain and GI symptoms, get a lot of that. If you are prone to UTIs, having some relief is important, but I would also add an antibiotic to that mix. I love this person's response. I think it's incredibly neurotic, but I identify with that. Again, this is great, but I think we can probably do it with less meds. A big part of preparation is making sure that you're prepared to deal with traveler's diarrhea. This is a 2015 systematic review. They did a PubMed search, Google Scholar, Cochrane Library review from 2012 to 2014. They found like 3,000 articles. They included 85. So this is a map that they have regarding the incidence of traveler's diarrhea around the world. It's truly going to be a prevalent problem for a lot of places that you're going to want to go. So we have the rule, boil it, cook it, peel it, or forget it. There's no demonstrable difference in the incidence of traveler's diarrhea, but how do you study that truly, right? It just kind of makes good sense biologically, so we encourage you to do it. The incidence of traveler's diarrhea on a 2-week trip is like 10 to 40%, okay, depending on where you go. The one thing that's shown to decrease the incidence of traveler's diarrhea is hand hygiene, and that can decrease incidence down to 8%. Okay, so again, making sure that you have hand sanitizer is important. Your causative organisms are like E. coli, Campylobacter, Salmonella, Shigella, rotavirus, norovirus, and Giardia. Cipro works against a good chunk of them. It's not really great against the viruses, Giardia and Campylobacter though. So azithro might be the better choice. Loperamide has the greatest efficacy against your symptoms, but if you're having symptoms of dysentery, you should not use loperamide until you've treated. Keep azithro and Cipro in your head now when we start talking about what antibiotics we want to bring. So from Dr. Benson, I bring Zofran, more Zofran, Pepcid, and my Lucky Charcoal tablets. She went to Bali a few years ago, got Bali belly, and was so sick that she had to go get healthcare in the city. The ride was horrible. Driver recognized she was sick and gave her charcoal tablets. She's usually a little more fastidious and would not take them, but was in so much distress that she just said, okay, and went with it. And it worked so well that now whenever she travels, so do they. Couldn't find any reviews on charcoal, but if you get good advice, what's up?
What is Bali belly?
It's essentially traveler's diarrhea.
Okay.
Yeah. Do they have a cute name for it? So when you're thinking about GI meds, again, we have, this is a little bit of our bread and butter from the ED, but you can get away with treating most of your major symptoms, your GI symptoms, or if you think it's like dyspepsia and heartburn, vomiting and diarrhea, you can bring 2 medications to be able to treat everything. So if you bring bismuth, which is your Pepto-Bismol, and Zofran, you are fairly well covered. Pain, again, this is really in our wheelhouse. I'm not going to spend a lot of time talking about treating pain, but some things I do want you to consider: how much alcohol are you going to be drinking? Be kind to your liver. Same thing though, like the flip side of that is NSAIDs and gastritis with alcohol. I'm going to say try and cut your alcohol intake. Is there a high likelihood of trauma? Again, if there's trauma, NSAIDs might be more efficacious for you. Think about bringing combo drugs, right? Alka-Seltzer, Excedrin, Goody Powder all have some combination of like aspirin, Tylenol, and caffeine. So I usually bring Tylenol, Motrin, and then one of the aspirin medications that have caffeine in it. For travel, Benadryl is the jack of all trades. It handles a lot of different problems that we may face, but it's sedating. If you're prone to motion sickness or cutaneous allergic reactions, you maybe should bring more selective medication. But if you don't typically suffer from these problems, Benadryl knocks out a lot of the problems we're going to have while traveling, and you're only going to need to bring more medication. I'm not going into prepping how to travel with kids because that's a journey in and of itself. But one of our pediatricians had mentioned that when they travel with their small child, once they get to the air train at JFK, that's when the child gets a little slip of Benadryl, sleeps through the entire flight. We're not going to out that attending, but somebody I trust and something I'm going to do.
Children can have paradoxical reactions. I recommend testing that theory before you go.
Yeah, know before you go. Don't give your child Benadryl and then realize that you just cracked up your child.
It'll be the first time you give them Benadryl.
Speaking from experience. No. Okay. Choosing antimicrobials. This is like, I kind of want to get your feel for this. This could be fun or exhausting, really. So this is from Dr. G. I was in China on a trip with a group, and several came down with severe dysentery, and I was able to take care of them. On the same trip, a little girl had an infected head wound, and I took care of it. Luckily, I had a zithro and bacillus with me. I think this is also important because the incidence of Giardia is higher in Southeast Asia. So if you're going to pick an antimicrobial for traveler's diarrhea and you're going to Asia, that should be where Zithro definitely takes preference over Cipro. Another great plug for topical antibiotics. You want to pick one or two medications that cover most things, right? Cipro covers your traveler's diarrhea, UTI, pneumonia. Bactrim covers UTI, skin and soft tissue. You can get away with most things by taking those two antibiotics. That didn't put a slide in for it, but for me, I kind of have this love-hate relationship with Doxy. All right, again, it's hard if you're going to go out in the sun, but Doxy is second or third line for a lot of different things, including traveler's diarrhea. It's not great for traveler's diarrhea though, because it's so rapidly absorbed that it doesn't get to the gut in high concentrations, but it does work against all of the pathogens with the exception of viruses. Okay. Does anybody travel does any of you guys go anywhere and always have a certain medication? Dr. G does a Zithro. Anybody else have anything?
Yeah, well, it depends where I'm going, but when I go to Haiti, for example, I always have Cipro with me because I've gotten traveler's diarrhea a few times, and that has responded. If it didn't get better in a day or two, I always had Imodium with me.
Yeah.
And as long as I had an antibiotic, I didn't feel bad about taking the Imodium. I thought I covered both. So I usually would have that. In Asia, I would also have a Zithro with me because the traveler's diarrhea in Asia is some of them are resistant, but not resistant to good doses of a Zithro. But I love Imodium because you have to function. People say, oh, don't take it. But you have to function, and if you're there working especially, or you're there enjoying yourself, you don't want to be running to the bathroom every minute or missing a trip. And so I like it. And like I said, you can cover yourself with an appropriate antibiotic with it. The other thing just I wanted to mention about antimicrobials is check if you're going to a malarious area. Because then if you are, you have to take malaria prophylaxis. And the other thing that very important that you probably will mention, but is besides sunscreen is insecticide. And I always take Deep Woods Off with me. That's the one I like.
That's one that's deep knit. So all those things that Dr. just mentioned, when you go to your CDC website, I again brought up Peru. Again, a lot of their stuff were insect-borne illnesses. You do need insecticide.
I'm sorry, just on that. The CDC website, it has a book both for doctors and for regular travelers called the Yellow Book. And the Yellow Book for doctors is great. And they update it every single year.
I didn't know about the Yellow Book.
And if you go on and go to the CDC, you'll find it. and it really has great recommendations, this yellow book, and it's online, it's easy to get, it's free.
Don, can you hear me, Don?
Yeah.
So one of the things that's important is know what country you're going to and know the laws there about drugs. Like when we go to Belize, you can buy almost anything you want in the pharmacy there. I always get antibiotics when I'm there. You can get narcotics when you're there, but it means you have to pack less stuff. It also means you can take stuff home with you when you come back from those countries.
A lot of countries in Africa, a lot of countries in Southeast Asia, you can purchase when you're there. I'm a neurotic, so unless I know where I'm going to purchase them there, I like to have them. I didn't go into malaria for this because I was trying to keep it like a little more vague, but I'm pro Malarone for the most part. Yeah, and then the other thing about loperamide, Dr. G was saying, like you have to be able to function, so you want to be not running to the bathroom every 5 minutes, but also volume losses, right? If you can't guarantee that you can keep getting water in, you need to make sure that you're not at least losing ridiculous amounts.
She had something
Yeah.
she wanted to say.
Yellow book?
Oh, so when I did a very long trip in South America, and so I didn't want to keep spraying myself with so much DEET and whatnot. So there's a spray that you can spray on your clothes to help prevent mosquito bites.
Yeah, you can pre-treat them.
Yeah, you can pre-treat them, which was fun because someone thought I was I did it on my balcony at night, and someone thought I was like someone trying to rob my house. But it worked. I didn't get any bug bites.
They have washes too where you can throw it with a load of laundry or in the dryer and then treat your clothing as well. You can also buy, when you go to like REI and specialty stores, they have like bandanas and things like that that are treated with insecticide, insect repellents.
So the stuff you buy like pre-treated was probably good for 20 or 30 washes. The stuff you put on yourself is probably like 5 washes. So it doesn't come off right away. So you can use it for many, many times.
Nice. Yeah. Don't be on your trip. And honestly, sometimes just being upstate, like
You gotta leave the nice hotel.
you have to leave the what?
You have to leave the nice hotel.
Oh, I know. So Dr. said it's like all of you guys, this is the shenanigans. Yeah, even like just upstate guys, the number of like gnats and mosquitoes, we call it the Adirondack SWAT. You see people walking around like swatting at the air. So make sure that you're, and you know before you go. So some food for thought meds. Antispasmodic, again, we're getting older, maybe having baclofen is great. For me, steroids. For a lot of MSK pain like that. Again, phenazopyridine, if you want UTI, I think that's important as much as treating. This person, again, brought up like reactive airway, albuterol, inhaled steroids, Pred or Dex. I think most people that have asthma or something like that are going to have the medication. I'm not bringing albuterol and Epi on every trip. Epi is expensive. That being said, Dex is good for a million things. Probably not bad to have Dex. I don't think any of us resident-wise have worked with Dr. Demetis, but yeah, I think nobody should die without steroids. If you work with Dr. Quayle, the tack onto that is nobody should die without Doxy for steroids. Some extreme considerations. These are not going to be for everybody, but if you're traveling above 8,000 feet, know that 8,000 is the cutoff. You should probably Diamox, also steroids. I love this, having a lac repair kit. I'm not bringing the whole kit, but I'll bring a straight needle. I have no fillings. I've never had a cavity, but if you do, having the over-the-counter dental kit, I don't know how often people lose fillings. And then I guess if you are Dr. Silver going to go diving, maybe having vinegar, right?
I wouldn't bring it with me, Don. Every single dive boat has vinegar. I wouldn't carry it with me.
There you go. Don't bother. Make sure somebody has it, though. Some things for comfort. What's that? It's for the salad. I love peanut butter. There are several trips where I've sustained myself on peanut butter and beef jerky, not because we didn't have access to food, but because we were poor. I identify strongly with this one. Don't get somewhere and not be able to drink because nobody's got a bottle opener. Don't lose that cap because you tried to open it with your teeth. Be prepared, but the multi-tool can't make it if you're checking a bag. Make sure that whatever you do want to bring, you can get on a plane. Coffee. Yeah. Don't mess up. Have access to your caffeine. I've been on trips where I've had rip-roaring headaches because I didn't think about having access to caffeine. Anybody have any questions or comments?
So I'll say, Don, that you talked about insurance and stuff. Dan, which is Divers Alert Network, is phenomenal insurance. And it's not only for diving. They'll pay for any extraction out of a country as long as you're more than, I think, 100 miles away from your home. You don't have to actually be diving. So getting Dan insurance, about $75 a year. And if you have to get airlifted out of a place, it's phenomenal to have.